Good evening, and welcome to what promises to be a very special night as we pair the Miriam Hospital Foundation annual meeting with the very best of our Miriam People celebration of tradition. I'm Susan Kaplan, chair of the Foundation Board, and while I am eager for the day this event returns to the in-person celebration we know and love, I cannot overstate how much it means that all of you have joined us tonight. Thank you. To get us started, please join me in welcoming Rabbi and Miriam Governor Howard Voss Altman, who will deliver the invocation. Rabbi?
As we prepare for the year ahead, my friends, it's more important than ever to remember those whose work and spirit bless our daily lives. We're so grateful to our physicians, our nurses, and the incredibly caring Miriam Hospital staff who day in and day out provide our patients with not only the highest quality medical care, but also the Jewish value of chesed, compassion and kindness for our patients and their families. We're so grateful to all the Miriam support staff, our administrators, our financial wizards, our risk managers, our executive board, for their extraordinary efforts during this time of uncertainty and crisis. We have been blessed throughout the year by their leadership, their vision, and their steady hands, steering us through choppy and perilous waters. And finally, we are so grateful to all of Miriam's volunteers, our board of trustees, our board of governors, and all of the lay people who give their time and energy to ensure the success of our institution. Without your generosity, your dedication, and your spirit, the Miriam would not be the inspiring community that it is. May our Miriam Hospital continue to be a light in the darkness. May it continue to be a place of healing and strength. And may it continue to be a source of kindness and compassion for all who walk through its doors. And let us say Amen.
Thank you, Rabbi Howard, and good evening, everyone. It's truly my pleasure to be with all of you this evening, and I hope that all of you and your families are safe and healthy. I want to thank the Miriam Hospital team, doctors, nurses, and all the staff for their extraordinary efforts throughout this pandemic. We owe them all a great deal of gratitude and appreciation. We have had some exciting new appointments at the Miriam Hospital this year, with Dr. Maria Duchan being appointed as the new president of Miriam Hospital. She is doing an outstanding job under very difficult circumstances. And we welcome Dr. Ann Schmidt, the new Senior Vice President in Patient Care Services and Chief Nursing Officer, and Dr. Mark Deach, Senior Vice President in Medical Affairs and Chief Medical Officer. We are also very fortunate to have them leading the Miriam Hospital during these difficult times. I also want to thank and recognize Susan Kaplan, Chair of the Miriam Hospital Foundation Board, and the entire Foundation Board, the volunteers, and the donor community. I am honored to be here to express my gratitude to all of you this evening. It's been an exciting and busy year for Lifespan. It has been just over 4 months since Coastal Medical became part of the Lifespan healthcare system. Combining Coastal's primary care expertise with Lifespan's vast capabilities in specialty services, research, and education enables us to deliver an unmatched level of coordinated, high-quality care to our patients. As part of the overall strategy to integrate Coastal into our system, Dr. Alan Caros has been appointed Senior Vice President for the Primary Care and Population Health for Lifespan Systems, in addition to his current role as president of Coastal Medical. We've also made some stellar new additions to Lifespan executive leadership team. Dr. Ken Wood, Executive Vice President and Chief Clinical Officer, Todd Conklin, Executive Vice President and Chief Operating Officer, and David Kirshner, Executive Vice President and Chief Financial Officer, all joined us within this last year as well. Lifespan and Care New England submitted a state and federal regulatory filing to merge our organizations. We are excited about what this could mean for our patients, our mission, and the Rhode Island and regional healthcare delivery system. A partnership between two superb nonprofit organizations with similar values to form a single integrated academic healthcare system with our academic partners, Brown University, will create opportunities to deliver improved, seamless, and coordinated care to our patients. We are working our way through the regulatory process and remain optimistic that we will bring this to a successful conclusion. Recently, Lifespan also created a new strategic plan to map out our path for the next 5 years. It's an ambitious framework we're calling Lifespan 2025, working to create a healthier future. The plan focuses on 6 key strategic areas, but is singularly rooted in one simple goal: making Lifespan one of the nation's leading academic healthcare systems. In closing, I am grateful to the Miriam leadership, physicians, and all the staff. So on behalf of myself and the entire Lifespan Board of Directors, my deepest thanks. Now I'd like to introduce the next speaker, the President and CEO of Lifespan, Dr. Timothy Babineau.
Thank you, Larry. Good evening to the Miriam Hospital Foundation board members, hospital staff, and guests. Although this is another virtual meeting, I am very glad you are joining us, and I thank you for your interest in the Miriam and in Lifespan. The Miriam Hospital is responsible for the well-being of so many people in Providence and throughout the state. Over the past 19 months, the Miriam stepped up with COVID testing, COVID vaccination plans and clinics, and cared for many, many COVID patients. In this second pandemic year, I know we have all grown weary. We have learned so much during the last year about how to prevent the virus and how to treat it. But most of all, we've learned resilience and patience. I am very proud of every team and every team member at the Miriam. They are all essential to the community, to the magnificent work done at this hospital, and to Lifespan. There are really no adequate words to express my appreciation. I want to personally thank you all for your support of the Miriam Hospital and for sharing this evening with us. Now, I have the great pleasure of introducing Susan Kaplan, the chair of the Miriam Hospital Foundation Board of Trustees.
Thank you, Dr. Babineau, and thank you for your leadership and support of the Miriam. During my opening remarks, I commented on how much I look forward to being able to share the same room with all of you when it is appropriate and safe to do so. At the same time, and this is something for us all to be proud of, we have proven over these past 20 months that even when we cannot be together, we continue to rise above and do whatever it takes to ensure the Miriam remains what it is, and that is best-in-class hospital, a special place of healing. I'd like you to think about that for a moment. As difficult as this time has been, it has perhaps also brought us closer, making sure that we are there for one another and for our community. You can see and feel the impact of every gift, of every kind gesture, every phone call and email that ultimately asks the question, what can we do to help? And that is because every member of the Miriam family has each other's back. All of us focused on what matters and what is most important. And that will be always our patients and delivering care of unparalleled quality. To do what the Miriam is doing right now during these challenging times, while still at the highest pinnacle of excellence, is beyond compare, but yet not surprising, because at the Miriam, we are always setting a higher example, and that absolutely includes our one-of-a-kind donor community, whose generosity was again on full display this past year. And perhaps nowhere was it more visible than during the take 2 of our highly anticipated Miriam Gala and Auction, roaring into the 20s. A night more than 2 years in the making, we were this close to being together at the Waterfire Art Center before the difficult yet necessary decision was made to move to a virtual affair out of an abundance of caution and a rise in transmission rates of the Delta variant of COVID-19. But as we do with any curveball thrown our way, we hit it out of the park thanks to the tremendous leadership of event chairs Dr. Howard and Nancy Safran, and a tireless committee that pulled out all the stops. The results? More than $1 million raised, including $664,675 to create the Center for Innovative Cancer Research at the Miriam Hospital. Hopefully, next year we'll see the return of an in-person Miriam Gala. And while I don't want to let anything out of the bag just yet, let's just say there's already a lot of excitement around the table. The gala, of course, was just one way donors stepped up with game-changing philanthropic support this past year, and we are grateful for each and every gift that was received. I'd like to take a minute to recognize all who made significant contributions of $25,000 or more. An anonymous $50,000 gift for our Greatest Needs Fund. Brian and Barbara Goldner, in honor of Dr. Anthony Mega, $50,000 for the Center for Innovative Cancer Research. The Edward J. and Virginia M. Ruthier Foundation, $50,000 for the purchase of a Hexaview integration system and associated equipment for managing the complexity of today's medical operating procedures. United Way of Rhode Island, $50,000 for salaries and costs associated with reporting and educational materials for the Center for Health and Justice Transformation. Amica Mutual Insurance Company, $47,500, a leadership gift for our gala event. Stephen A. and Diana L. Goldberg Foundation, $35,000 for Cancer Center Nursing Education. University Orthopedics Incorporated, $35,000, leadership gift for our gala event and tribute gift to honor Arthur J. Sampson. The Miriam Hospital Women's Association, $33,164 to purchase 22 air scrubbers, HEPA filtration cleaning system, 5 electrostatic cleaning sprayers, and a blanket warmer, a gift to the Cancer Center Complementary Therapy Fund, and a tribute gift to honor Arthur J. Sampson. The Joseph S. and Rosalind K. Sinclair Foundation, $30,000 for our Greatest Needs Fund and our gala event. Warren Alpert Foundation, $30,000 for the Resilience and Wellness Program and the Center for Innovative Cancer Research. Anonymous, in honor of Dr. Stephen Schechter, Chief of Colorectal Surgery, $25,000 for the Center for Innovative Cancer Research. Brown Physicians Incorporated, $25,000 leadership gift for our gala event. Dr. and Mrs. Leon N. Cooper, $25,000 for our Greatest Needs Fund. James R. Myers, MD, $25,000 for the Brown Kenya program and the Lifespan Lyme Disease Center at the Miriam. Mr. and Mrs. Mark A. Ross, $25,000 for our Greatest Needs Fund. Gertrude and Max Zisson Endowment, $25,000 from Harry Zisson, supporting the greatest needs within cardiology. Marilyn H. and James R. Winokur, $25,000 for the Center for Innovative Cancer Research. Turo Fraternal Association, $25,000 for the Center for Innovative Cancer Research. Thank you all for your remarkable support. The Miriam also was the beneficiary of several transformational gifts last year. Anonymous, $1.5 million to establish an endowed professorship in translational medicine, which advances research and treatment of autoimmune diseases. Anonymous, $125,000 for the Center for Innovative Cancer Research. David and Betsy Kilmartin Charitable Foundation Incorporated, $115,000 to establish the David, Betsy, and Kelly Kilmartin Nurse Residency Education Award Endowment. The Norman and Rosalie Fain Family Foundation made 2 gifts totaling $105,000, with $55,000 to support a part-time nurse practitioner for post-operative colorectal senior patients and $50,000 for renovations and improvements throughout the Fain building. The Hassenfeld Foundation, $100,000 for the Center for Innovative Cancer Research. Our deepest thanks and appreciation for these extraordinary gifts. It is also my pleasure to welcome our newest Miriam founders, individuals and organizations who have taken their support of our hospital to a new level, having donated or pledged $25,000 or more over their lifetime. My most sincere thanks to Anonymous, Mr. and Mrs. E. Colby Cameron, Dr. and Mrs. Leon N. Cooper, Cox Business, Brian and Barbara Goldner, Mr. and Mrs. James V. Rosati, Mr. and Mrs. Mark A. Ross, Dr. and Mrs. Howard P. Safran, Sodexo Incorporated and Affiliates, Mr. and Mrs. Donald L. Stanford, Toro Fraternal Association, Warren Alpert Foundation, Elaine and Howard Weiss. We'd also like to welcome our newest Living Heritage Society member, Ms. Jennifer S. Vandal. Unfortunately, the past year was not without its sadness, as the Miriam lost some very dear friends. We remember Mr. Stanley Blaker, Mr. Brian D. Goldner, Mrs. Helen F. Grossman, Mr. Justin J. Strauss, Dr. Howard S. Sturm, Dr. Leonard J. Triedman, Mrs. Marilyn H. Winokur. We will miss these special people, but will cherish their memory and contributions to the Miriam forever. One of the most rewarding aspects of my role as chair is also to be part of a very special subcommittee of the board that allocates foundation dollars back to the hospital, investing in areas that align with both the hospital's priorities and the areas of greatest need. This year, I am delighted to share that we allocated more than $1.3 million. And here are just a few of the highlights. $200,000 to the Center for Behavioral and Preventive Medicine, $100,000 to support our Community Relations Program, $250,000 for an Innovation Center for Urologic Research and Education, $160,000 to support a Fellowship of Resilience Program, $225,000 to implement the Human Experience Institute for our staff. As we've all now been living through the same crisis for nearly 2 years, I don't want to spend more time talking about all of the things we already know, the uncertainty and the unpredictability, the new challenges and stressors that come with them. Instead, I want us all to look at this point in time as the moment at which we've mastered resiliency, allowing nothing to come in our cumulative way of doing the absolute best job possible, no matter what that job may be. And that is a testament to our people, from leadership, physicians and nurses, to environmental services, valet, and of course, all of you. Simply, it is palpable how much everyone cares about this hospital, and it shows. It shows in the fact the Miriam is among an exclusive group of hospitals worldwide to attain magnet designation 6 times. And it shined brightly when U.S. News and World Report named the Miriam the top hospital in Rhode Island again. None of this happens by accident. It happens because we're all working toward the same goal, with the same vision and the same commitment and determination, no matter the circumstances. To me, that may be the most impressive accolade of them all. I'd like to thank Maria Ducharme for her leadership and express my appreciation to Dr. Timothy Babineau, Larry Aubin, the entire Lifespan Board, and my foundation colleagues for their support and invaluable insights. I would also like to recognize the Miriam's clinical leadership team, Dr. Mark Deitch and Dr. Ann Schmidt, for their extraordinary work and compassionate commitment to our patients and their families. And in our development office, my deepest gratitude to Holly Palermo, Kim Borick, Cheryl Kusan, Dawn Howard, and Helen Shore for their Herculean efforts of the past year and for always making sure the Miriam remains top of mind for our donors. I would now like to introduce Dr. Eric Walsh, President of the Miriam Hospital Medical Executive Committee, who will deliver the Medical Staff Association report. Dr. Walsh?
Thank you, Susan, and good evening. My name is Dr. Eric Walsh. I am the current president of the Miriam Hospital Medical Staff Association. It is my great pleasure to represent the Miriam physicians and staff at this annual meeting of the hospital's Foundation Board. Over the last year and a half, the Miriam physicians and staff have performed in an exemplary manner, providing top quality care and safety to not only our patients, but also to each other during these difficult and challenging times. With all the challenges that we have faced, our medical staff continues to expand as new clinicians realize what a top-performing hospital offers them professionally. This is why this year, the Miriam was again awarded honor of being the top hospital in the state. One of the most important reasons the Miriam continues to excel is based on the outstanding dedication and service of our physicians and staff. Sadly, we lost Dr. Charles C.J. Carpenter last year, the very physician whose name is bestowed on one of our annual awards. I would like to read the excerpt from his obituary. Dr. Charles Colcock Jones Carpenter Jr. was a pioneering medical researcher. He is remembered as a mentor to many doctors, an innovator in cholera and HIV/AIDS treatment, and a big-hearted family man. Dr. Carpenter was especially passionate about ensuring the fair treatment of all people, especially those unfairly disadvantaged by societal forces. In 1986, Dr. Carpenter became physician-in-chief at the Miriam Hospital and a professor of medicine with the Brown University Department of Medicine. He also served as the director of the Brown University International Health Institute and the director of the Lifespan Tufts Brown Center for AIDS Research. Dr. Carpenter died peacefully at home on March 19, 2020, with his wife Sally and his sons by his side. I'd like to continue our recognition of important people with whom I work and recognize the hard work and dedication of Jessica Gotchen-Smith, Interim MEC Director, and Jennifer McNeely, MEC Executive Assistant. Thank you for all your support and dedication. This year, the Miriam recognized 3 physicians for their outstanding achievements. The first award is the Reisman Excellent in Teaching Award. This year, the award went to Dr. Depa Afri. Dr. Kwame Depa's relationship with the Miriam Hospital and Brown University began in 1993 when he started his internal medicine residency. He and a colleague of his started the hospitalist program at Miriam Hospital in 1997. And then, as he frequently is called, Kwame was named the director of the Division of Hospital Medicine in 2004. Kwame was also instrumental in the establishment of the hospitalist program at Newport Hospital. Kwame pursued additional studies at Bryant University and earned his MBA degree with honors in 2009. Kwame is professor of medicine at the Warren Alpert Medical School of Brown University and serves on its admissions committee. He has received several teaching awards from the Department of Medicine of the Warren Alpert Medical School, including the prestigious Beckwith Family Teaching Award in 2011. Dr. Depa has been named annually as one of Rhode Island's top doctors since 2009. In 2011, Kwame was the recipient of the Charles Carpenter Miriam Hospital Physician of the Year Award. In 2017, Dr. Depa was elected as one of the AOA professors of the AOA chapter at the Warren Alpert Medical School of Brown University. Kwame serves on the Lifespan Risk Management Committee and the Miriam Hospital Medical Executive Committee. For the past 5 years, Kwame has been chair of the Brown Medicine Audit Committee. The next award was the Charles C.J. Carpenter Outstanding Physician of the Year. This year it was my great pleasure to present this award to Dr. Karen Tashima. Dr. Karen Tashima received her medical degree from the College of Physicians and Surgeons at Columbia University. She trained in internal medicine at the Presbyterian Hospital of New York City and in infectious diseases at Massachusetts General Hospital in Boston. Dr. Tashima joined the Brown University Infectious Diseases faculty in 1995. Dr. Karen Tashima is the scientific director of HIV care at the Miriam Hospitalist Immunology Center. She directs the NIH-funded HIV clinical trial unit at the Miriam Hospital to investigate new treatments and potential curative strategies for HIV infection. She developed national studies to improve HIV therapy within the AIDS Clinical Trials Group Network. Dr. Tashima serves as the chair of the Miriam Hospital IRB. In the summer of 2020, she received an NIH grant to facilitate COVID-19 vaccine trials in Rhode Island. She's a member of a COVID study advisory group for Lifespan. She serves on the Rhode Island Governor's appointed COVID-19 vaccine subcommittee, providing advice on the use and equitable distribution of the EUA vaccines for the state. She has received numerous awards and accolades. The Association of Nurses in AIDS Care Award for Outstanding Research Article contributed to the Journal of the Association of Nurses in AIDS Care, 1999. Honored at the annual Southeastern Massachusetts Conference for those living with HIV/AIDS and those who care for them, 2002. HIV Leadership Award as Outstanding HIV/AIDS Clinical from thebody.com and thebodypro.com, 2005. The final award was the Charles Bud Kahn Lifetime Leadership Award. This year it was my great honor to present this award to Dr. Richard Bezdine. A graduate of Haverford College and the University of Pennsylvania School of Medicine, he trained in internal medicine, infectious diseases, and immunology at Boston's Beth Israel Hospital and Harvard Medical School. Dr. Bezdine trained in geriatrics at the University of Glasgow in 1972 with Sir Ferguson Anderson. He is board certified in internal medicine, geriatrics, and infectious disease. Dr. Richard W. Bezdine has devoted his career to development and advancement of geriatrics through university-based and public health care policy work. He has developed and managed research, healthcare delivery systems, and educational programs on aging at a university base and served as a senior healthcare executive in the federal government. He is currently professor of medicine and professor of health services policy and practice at Brown. In the fall of 2019, he stepped down after 20 years as director of the Division of Geriatrics and Palliative Medicine in the Department of Medicine, chief of geriatrics for Lifespan, and first career professor of geriatric medicine at the Warren Alpert Medical School at Brown University, and as director of the Center for Gerontology and Healthcare Research at the Brown School of Public Health. Dr. Bezdine served as interim dean of medicine and biological sciences at Brown Medical School from 2002 to 2005. He also serves on the board of directors of Neighborhood Health Plan of Rhode Island, the state's Medicaid plan. He currently devotes his time to teaching, mentoring, and research. His honors and awards are numerous. Dr. Bezdine has authored more than 125 scholarly publications on aging and edits widely in medicine. He began his academic career at Harvard Medical School, where he co-founded Harvard's Division on Aging and developed one of the first academic geriatrics programs. Dr. Bezdine spent 1995 to 1997 in federal service. He was the first chief medical officer and director of the Health Standards and Quality Bureau for the Healthcare Financing Administration, now CMS, responsible for setting standards, inspection, enforcement, and improvement of healthcare quality for the nation's then 70 million Medicare beneficiaries and Medicaid recipients. He managed 750 staff and a $960 million annual budget. I know I speak on behalf of the medical staff when I say that we feel privileged to work at such an outstanding hospital and among such accomplished, dedicated, and outstanding teachers, scholars, mentors, and physicians. I would like to thank the Miriam Hospital Foundation Board and our donor community for your ongoing support of our staff, especially over the past 2 years. It is our pleasure and honor to care for you at the Miriam. I would now like to turn the podium over to the Miriam Hospital's president, Dr. Maria Ducharme.
Thank you, Dr. Walsh, and good evening, everyone. While I would have loved to be delivering my first president's report in person, I am nonetheless excited to share with you the year that was at the Miriam. Against the backdrop of the worst global health crisis in more than a century and the many challenges that have come along with it, it's difficult, as you've been hearing about, to not call out and recognize the numerous and incredibly significant achievements. Along with the designations highlighted earlier, we saw some tremendous regulatory wins. We earned our third metabolic and bariatric surgery accreditation, and at this time, we also became the first and only program of its kind in Rhode Island to earn national accreditation from the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program in obesity medicine as well. This means we meet all criteria of national quality standards established to deliver safe, high-quality metabolic and bariatric patient care. We not only meet the guidelines, but we're noted as having numerous exemplars. The American Heart Association and American Stroke Association presented us with its Get With the Guidelines Stroke Gold Plus Award, including representation on the Type 2 Diabetes Honor Roll and the Stroke Honor Roll Elite. A primary stroke center, the Miriam continues to reach an aggressive goal of treating patients with 85% or higher compliance to core standard levels of care as outlined by the American Heart Association. And during the Joint Commission's most recent survey of our total joint center, I can proudly say that it was nearly a flawless review, with not a single deficiency found or suggestions for improvement given. Of course, we know we cannot paint a picture of the year solely with a rose-colored brush. COVID-19 remains present, and with it are the effects we expect will take some time to recover from. Both regionally and nationally, we have been hearing about staffing issues. And while they have hit all organizations in a different manner, we certainly have not been immune. To persevere and achieve all that we have highlights the outstanding culture of the Miriam Hospital. But the byproduct of the pandemic we're dealing with, and not necessarily because of COVID patients, is the changing dynamic of our workforce. We've come so far. Our staff is incredibly competent and efficient in caring for patients who have COVID. They've become experts in something they didn't even know about less than 2 years ago. And getting there meant it was an all hands on deck, often working in areas that were not familiar, but doing so collaboratively and with purpose. It was not without its cost. We've had staff retire early, others have left for different opportunities, and some new staff have taken a bit more time to get acclimated to such an environment. Our seasoned staff are supporting and helping to train a new wave of employees in real time and onboarding many talented people. It can be a lot, never mind while running parallel to a health crisis. We know that staff is fatigued, and rightfully so. You know as well, and you respond with unbound generosity. And that's an enormous part of why people choose to stay and come to the Miriam. People want to work here because of the way our community supports them and stands alongside them. Wellness and resiliency are constantly top of mind for me and our leadership team, and it is your generosity that has enabled us to bring our programs and our focus to new levels for our staff in ways that are important to them. For some, it is a yoga class or a quiet space for respite. For others, it's having someone to talk to or taking time for an alternative therapy, such as massage or Reiki. We're doing all of these things to help support and retain our most valuable resource, our people, and you help to make that possible. The people here are the most committed and dedicated individuals you'll ever find. They're committed to one another, and they're committed to their patients and this hospital. And while there's fatigue, there's also optimism for getting back to a degree of normalcy, and for some of the exciting new things on the horizon. The pandemic did not pause or stop our hospital's progress or cause a loss of focus on the needs of our community or our facility. I am happy to say our pharmacy has been completed and has quickly become a vital resource to the Miriam on a number of levels. It has further streamlined our process for discharging patients, creating a new level of efficiency in which more patients are receiving their medications before they leave this hospital. This improves not only medication communication, but also prescription compliance and a reduction in readmission, as oftentimes patients simply do not get their medications after discharge. By the spring, I expect our new endoscopy suite to be up and running. As I'm sure many of you recall, the emergency department has been utilizing some of this space to help manage volume, and that's been of great benefit. But as we've grown our endoscopy program and rely on it for increasingly complex procedures, this suite will allow us to deliver a seamless patient experience in a single location in the hospital, while also enhancing the delivery of care by our providers and care teams. These are both tremendous strides towards our hospital's bright future, and where I feel there is even more we can do. The Miriam never rests. I'd like to take a moment to also acknowledge the new leadership team. Dr. Ann Schmidt, our Senior Vice President for Patient Care Services and Chief Nursing Officer, and Dr. Mark Deach, our Senior Vice President of Medical Affairs and Chief Medical Officer. A nurse for more than 30 years, Dr. Schmidt joined us in May after holding leadership positions with a hospital system in Virginia and previously in Rhode Island. And Dr. Deach, an accomplished orthopedic surgeon, came aboard in September, most recently having led a large orthopedic service line for WellSpan Health in Pennsylvania and Maryland. Dr. Deach is also not a stranger to Rhode Island, having attended Brown University as an undergrad. They are incredible additions to our team and have hit the ground running. I am thrilled that they both chose to bring their expertise and talents to the Miriam. I'd like to thank the Foundation board members and Chair Susan Kaplan for your continued support, and also my Lifespan colleagues and Miriam staff for your unwavering commitment and dedication. We have so much to be proud of at this hospital: our traditions, our people, our physicians, and our extraordinary nurses. And although these times remain especially challenging, the Miriam exudes the compassion, hope, and healing our community needs, and that we consistently deliver at only the highest level of quality. I could not be more appreciative of or grateful to each and every one of you. Thank you. It is now my pleasure to introduce someone who may need no introduction to many of you joining us tonight, former president of the Miriam Hospital, Dr. Kathleen Hittner, who will present the annual scholarship award aptly named in her honor. Kathleen?
Thank you, Maria. Good evening. I'm happy to be with you tonight to announce this year's Hittner Scholarship winner, Jocelyn Stanfield. Jocelyn began her career at Lifespan in July of 2020 and is a research assistant working with Dr. Laura Stroud in the Center for Behavioral and Preventive Medicine. Jocelyn enjoys her work in the lab as a maternal interviewer, where she speaks with expectant mothers about their mental health, substance use, and other lifestyle factors during pregnancy. Outside of her research assistant responsibilities, Jocelyn has presented her research at Brown University's Public Health Research Day and the meeting for the Society for Birth Defects, Research, and Prevention. Jocelyn has additionally received 2 poster awards and the Institute for the Recruitment of Teacher Fellowship. Jocelyn tells us that she's incredibly honored to receive the 2021 Kathleen C. Hittner, MD, Educational Scholarship Award, which she will use the funds associated with the meeting of the International Society for Developmental Psychobiology Conference in November, very soon. Jocelyn is currently in the process of applying to PhD programs for clinical psychology. As a graduate student, Jocelyn summarized her future goals by saying, "I hope to create new knowledge about the impact of perinatal adversities on child psychopathology, with the ultimate goal of alleviating racial disparities in the field of mental health." Jocelyn's manager says that Jocelyn is an uncommonly hardworking and self-motivated young researcher. Her brilliance, natural curiosity, and clear commitment to research on the developmental impacts of maternal substance use in marginalized communities have led her not only to ask important questions, but to go out of her way to develop novel strategies for reaching out to the most vulnerable. Jocelyn is well-liked and well-respected within our lab as both a demonstrably strong critical thinker and a consummate teammate and scientific collaborator. We're so grateful to have her as part of our team and excited to see her shine as she moves forward in her career. Jocelyn will receive a $1,200 scholarship toward the conference she will be attending next month. Jocelyn, please join me at the podium to receive your award. Congratulations, Jocelyn. I hope you have a very good meeting, and I hope you do really well in all your future endeavors. Thank you for all your hard work.
Thank you so much.
I'd now like to turn the podium over to Barbara Horvitz Brown, President of the Miriam Hospital Women's Association. Barbara?
Thank you, Dr. Hittner. Good evening. I'm Barbara Horvitz Brown, President of the Miriam Hospital Women's Association, and I am pleased to report on the accomplishments of the Women's Association this past year, our second with COVID in the background. We were, nevertheless, able to strive for our goals of educating and connecting the community and raising funds for the Miriam. Last year, our programming vice presidents, Robin Kaufman and Neil Hartman, agreed that because people were staying home due to the pandemic, we would do 3 instead of our usual 2 programs. We had Wendy Schiller, political analyst, speak before the election, and then we continued Zoom programming with a focus on COVID as 2 doctors from the Center for Behavioral and Preventative Medicine at the Miriam, Dr. Ernestine Jennings and Dr. Elena Salmorajo-Blochet, spoke with us in January about mental health, stress, and anxiety. And by the way, Dr. Laura Stroud, director of this program, gave us more insight into the center when she spoke to the Women's Association board after our November 8th board meeting. Then, to prepare for being outdoors in the spring, we had 3 lifespan doctors, Drs. Lynn Eiler, Paula Moskowitz, and Julia Baltz, give an informative presentation on skincare myths and realities. Our fall program this year took place on October 27th and featured well-known Rhode Island author Ann Hood and her author and chef husband, Michael Ruhlman, sharing their thoughts on food, life, and love. Just the upbeat kind of program we all could use. Our programming chair for this year is Robin Kaufman, and presidential appointee Jill Smith has now stepped in to assist with programming and other technological issues beyond the scope of many of us. One of our membership VPs, Eleanor Koo, also moved into the background this year, but not before hosting a successful fundraiser at J. McLaughlin in the spring, which raised $1,015. This year's membership VPs, Judy Siegel, also our honoree at our annual meeting, and Marilyn Myro, who is continuing in the membership vice president position, report that we have 585 members, 176 of whom are annual members, and 409 are lifetime members. There were 9 new annual members in 2021 and 1 new life member. Our Equip for Exceptional Care event last year, headed by Susan Guerra and Paula Cafone, raised $16,602 for COVID-related equipment. The Women's Association added to that amount because of the compelling need last year and advanced a total of almost $25,000 to the Miriam for them to purchase electrostatic sprayers and air scrubber HEPA filtration systems. Our Equip for Exceptional Care vice presidents this year are Barbara Kahn and Nancy Riffle. They will be spearheading the important efforts to raise money for a stretcher scale and wheelchair scales for the ER at the Miriam. It is a wonderful way to fulfill the wish list of some Miriam departments for equipment that might otherwise not get funded, and is an exciting part of our mission. The Women's Association also donated $3,065 to the Emergency Preparedness Fund at the Miriam last year, and an additional $1,000 to the Arthur Sampson Endowed Fund. The Women's Association continues to do other fundraising through individual funds. Several of those funds, the Zerum, Swetchkenbaum, and Litwin funds, came together this year with the support and prompting of Sharon Ferrari, a past president of the Women's Association, driven by her father's experience on Unit 3B, to provide a blanket warmer for that unit at a cost of $4,775. Individual donor funds donated another $1,100. 2 longtime fundraising sources, the BRIC program and the gift shop, are being retooled going forward. A donation of $2,500 was made from the BRIC program to the Comprehensive Cancer Center in October 2020, and this year will donate $1,315. Because of space and costs, the direction of the BRIC program is up for discussion. The gift shop, which changed places with the pharmacy due to space needs, also underwent major discussions before coming to the decision to contract with Lori's Gifts to run the gift shop when it reopens soon. I want to thank members of the gift shop committee, some of whom worked for 3 years on the future of the store, especially Robin Engel, Mary Ann Litwin, and Cynthia Schwartz, but also Sherry Cohen, Susan Guerra, Mary Gagnon, and Barbara Horvitz Brown, assisted by hospital administration, for all the time that was devoted to reaching this excellent conclusion. Our sale of leftover merchandise from the old gift shop raised $5,310. We have been told by Lori's that the gift shop will open on Tuesday, November 23rd, and there will be a grand opening on Monday, November 29th, with games and prizes. One other committee deserving kudos worked many hours last year on revising the bylaws, which according to our records had not been revised since 2004. The 2021 bylaws were voted on and accepted at our June 2021 meeting. I want to thank our hardworking committee consisting of Susan Leach de Blasio, our legal consultant who drafted the final version and whom we relied on heavily through this whole process, Barbara Horvitz Brown, Sherry Cohen, Barbara Kahn, Mary Ann Litwin, Marilyn Myro, Karen Trinkle, and assisted by Vicki Scott, our administrative assistant. I also want to thank our board and officers, and especially our patient and available treasurer, Marianne Litwin, with whom I am regularly consulting, and Vicki Scott, our right-hand woman. I will end my part of this meeting with a song I wrote, but not the tune, to share my connection with the Miriam and my thanks to my board, but I hope you will enjoy it too. Maria and Holly, who attended our Women's Association annual meeting, welcome the reprieve tonight. I will preface this by noting that in this song, I refer to my husband, Jeff, his paternal grandmother, Frances Grant Brown, also known as Fanny, and his paternal great-grandmother, Mary Grant, a founder of the Miriam. There is a hospital in Providence. It's called the Miriam. It's been around almost 125 years. It was founded by Jeff's great-grandmom. Great-grandmom was a milliner. She sewed hats that looked real nice. People came in just to talk to her because she gave good advice. St. Joseph's was another hospital where Jewish people stayed. But when it came to time to eat, no kosher meals were made. So Mary put pushkis into many stores, told others to do the same, collecting funds for meals and more. The Jewish hospital was her aim. Must be at Miriam Women's Association. Mary was its first president. Her daughter Fanny was president too. I'm just following family precedent. My other Miriam connection, I certainly can't ignore, is that Jeff and I became engaged on the Miriam elevator. True story. I want to thank my Miriam cohorts for getting us through this year. Gift shop and bylaws committees have worked more hours than expected, I fear. This pandemic year was not the easiest to carry on as before. But programming, membership, and equipment fee, please move COVID to the fore. As I begin my second year as head of TMHWA, I want to thank Vicki and my awesome board. With their help, we'll carry the day. Now I'd like to welcome to the podium Mr. Edward Feldstein, who will present the nominating committee report. Ed?
Thank you, Barbara. I am pleased to present the Miriam Hospital Foundation Nominating Committee report for this year. For the Foundation Board of Trustees, the following trustees are nominated for reappointment by the Lifespan Board to serve a 3-year term: Joseph Prideaux Jr., Stuart Feldman, Debbie Gilstein Jaffe, Susan Kaplan, Marcus Mitchell, Dr. Matt Vries, and Dr. Ed Wing. The following trustees are nominated for appointment by the Lifespan Board to serve a 3-year term: Jim Rosati and Sherry Schweitzer. A trustee appointed to be a life trustee is David Rampone, and officers recommended for selection at the first meeting of the Foundation Board in fiscal year 2022: Susan Kaplan, Chair, Steve Issa, Vice Chair, Al Hall, Treasurer, and Debbie Gilstein Jaffe, Secretary. For our Board of Governors, the following current governors are nominated to serve a 2-year term: Helen Anthony, Sandy Elias, Dr. Elaine Fain, Mary Flynn, Julie Gerstenblatt, Adam Greenman, Dr. Tony Mega, Dan Rampone, and Jane Stanford. And we welcome our newly appointed governors nominated to serve a 2-year term, Dr. Bill Corwin, Steve Higginbotham, Hal Horvat, Kelly Kilmartin, Randy Martinez, Carolyn Roberts, Wilt Sonis, and Steve Zubiago. Our chair-appointed governor to serve a 1-year term is Robin Engel. I'd like to also thank and recognize the following trustees and governors who have completed their terms for all of their support and dedication to achieving our mission to inspire one another to improve the health and spirit of the lives we touch. Trustees Mark Gim, Joe Nagel, and Jason Sipperstein. Governors Bob Camara, Bob DiMuccio, Dr. Vincent Pera, Jerry Salmonson, and Dr. Steve Schechter. And sadly, we lost 2 of our life governors over the past year. We remember Stanley Blaker and Jay Strauss. Finally, I would like to thank the members of this year's nominating committee for their assistance with this process. Steve Issa, Jamie Manville, and Michael Prescott. I'd like to turn the podium back to our chair, Susan Kaplan, for our closing remarks this evening. Susan?
Thank you, Ed. Thank you again for joining us and for being a part of tonight's event. It is because of you that so much of what we celebrated this evening is possible. This concludes our program. Have a great rest of the night, and please stay safe and well.